Right, hi. My name's Enrique, and I thought I'd do this blog because I remember when I was trying to go through, I was trying to get as much information about getting my nails done. There wasn't a lot of information I found out there to help me. So I thought I'd do this. I am 1 month post-op, so I've gone through the surgery and had the bandages taken off, etc. It's My experience personally has been really, really good. I've been very, very happy. It is actually a revision. I had trauma done to my nose when I was 15, and it got split open from there to there. I don't know whether you can see it very well, but it's very faint now. And I went to A&E, they stitched it all back, and it sort of overlapped, and it was just awful. All my nose was crooked on my left hand side, and it was just a really, really, the results were awful. I was so miserable, and then I got on the NHS. I got reconstruction surgery. And I didn't have that much control over that surgery because it was the NHS and they just did what they thought needed doing. But I think the doctor meant well, and he got rid of so much cartilaging, and but he said that the cartilaging was damaged, and so although it did look better, I was very miserable about it. It wasn't what I wanted. I didn't feel like I looked like myself. The whole thing just freaked me out, and then I was left with breathing problems, and which was really upsetting for me because it's been 20 years and I'm still struggling to, I'm still sleeping, getting a dry mouth when I'm in bed. I can breathe a little bit, but it's not enough to be comfortable. So anyway, I spoke to my partner about it, and he said mainly because he didn't think that I needed my nose done. He thought it was fine. He said, he says, it's not perfect, but he said, I knew you when you were like this, and I love you just the way. And that was very sweet, but it wasn't really about him. It was about me and what I wanted, and I wanted to feel comfortable. So I went to see a plastic surgeon, and I started off. First of all, decided I would keep it in the country because I think you're much safer in there because they do have rules in this country, and you go abroad, you're trusting people to give you anesthetics, and there's been some awful horror stories because you go abroad and they can get away with so much, and people have died, for God's sake. So I really wouldn't recommend, going the cheap route. I think you should just be safe. It's your face and it's your life, so you should put it in good hands. Now, I went to the Spires in Manchester because it's local to where I live, because I live close to Liverpool and Southport, and they have really good surgeons there. So I chose Mr. Murphy because he's got such a good reputation, and he's a really, really talented plastic surgeon, and he's done over 1,000 nose jobs. Now, he does look a little bit young, which threw me a little bit, but don't underestimate this guy. He's got a passion for it, and with him being, younger, he still sort of, enjoys his work. With some people are close to retirement and they just lose their interest, but this guy's got his heart and his soul in this work, and everything he does, he wants to do it perfect. He's got a strong passion for it, and I just knew I had the right plastic surgeon. He also had like this 3D machine, which is really good because we could discuss together exactly. Exactly what I wanted, and the risks and everything else. Now, regardless of all my problems and that, he said to me, we'll go for it. And I also forgot to tell you that it wasn't just that accident when I was 15. It was also 7 years later I had a really bad break here and a bit of a break here as well. So I kind of felt like I had a nose like a bit like a boxer's. It wasn't a nice nose anymore, and so anyway, he got what was meant to try and get some cartilage from my nose and put it here to get a straight profile. It turned out he couldn't use cartilage in my nose, so he just took it from my ear, and I woke up to all these stitches, which I have no problem with because he's using my own cartilaging still. So he's put it in there, and there's like bits of it floating around, trying to put back depth in my nose. So I have no definition, the plastic surgeon sort of just gave me nothing. It was just an odd looking nose, and so he's put a little bit back in here as well, brought in my nostrils a little bit so that it would go with the width that the last doctor had taken, and in fact he's made it a little bit prouder now, so it looks like a proper nose, you know, it looks normal. So now when I look in the mirror, the first thing I look at is putting my eye makeup on and my lipstick. I've noticed other things about my face, because all I used to see was this awful nose. I hated looking in the mirror because it, and you know, and a lot of people they just kind of direct, you know, oh, if you broke your nose, what do you think? And when they bring that attention, I feel like that's all they can see about me. So it's not a nice thing for people to say, and it kind of stays with you, you know. So I finally, I mean, it sounds crazy, but at the age of 50, I finally decided to get my nose done. And only because I had such a bad experience before that I was scared to get under the knife again. But anyway, I went ahead with it, and Mr. Murphy's really not let me down. He's done an amazing job, and his team, they are really good people. The whole experience has been wonderful for me. I have not... You know, the part that I just didn't like is after the surgery, you know, you've got this congestion and you feel a bit embarrassed going out because you've got bandages or whatever, and then you're always so scared about people seeing it. In the early stages, it doesn't look that nice because it's swollen, you know. So, and people want to meet, you know, see this nose looking, you know, at its the end results immediately, you know, and you're not going to get that. It's not an easy thing having a nose job. You've got to be patient, particularly if you've got thicker skin, because it takes even longer. So you don't really get to see the proper definition of your nose until, you know, up to a year, even 2 years, depending on the thickness of your skin. So, and the other thing is, if you do go, please don't try and ask for a nose that belongs to some movie star, because it doesn't go with your face, it goes with theirs. You really got to work with what you have. I still like mine slightly wide because it would make my eyes look too far apart, you know, because this is the face I was dealt, you know, and so you really do have to be sensible, you know, if you're getting it done, because otherwise you're just going to be let down. Right. The other thing I wanted to say is that my experience at Spies was fantastic. Even the food there was brilliant. They do like an a la carte menu, and I found that I didn't have much of an appetite, but I couldn't say no because I paid for it, and it turned up, it was lovely. So I actually felt quite good when I left. Felt like I'd relaxed for a couple of days, because I've got pets at home, they'd always jumping all over me. So that I didn't find staying overnight a problem, and I did find that everybody there had a lot of time for me if I needed it. You know, that you just had to bell them, and they just popped straight in. They kept filling me up with coffee if I wanted it, fresh water, you know, etc. But yeah, it was a really good experience. So I mean, I hope everything I've said, you know, is going to help someone who is about to go through it. But the main concern really is choosing your plastic surgeon. You choose your plastic surgeon, you're going to have a really good experience throughout the whole thing. You know, it's because you're in good hands, your professional hands. If you try to economise with the fees and that, you're trusting someone that mightn't be suitable to not only do the surgery but giving you an anaesthetic from God knows who. So the advice I'd give is definitely 100% don't economise when it comes to cash. Go and do it properly. It's your face, it's your life. So don't trust it in anyone's hands, because they convinced you that they can do this great thing at half the price. Right? You're meant to pay a certain amount of money because there's a lot of people involved in the surgery and they all have to be paid. So to cut corners, that just sounds to me like a very dodgy thing for someone to do. So I wouldn't go there. There's very, very good surgeons in this country. You don't have to venture far to find a good surgeon. My experience with Mr. Murphy's is absolutely fantastic. I mean, I'm so glad I used him. But I did do a lot of research, and he really is a very talented guy. Anyway, I'm going to do another, because I'm going on a little bit now. I'm going to do another blog, maybe in another couple of months. It'll be 3 months, and then you can see if the changes, you know, from my nose now to then. Right, I'll just quickly show you how it looks now. Right, you can see it's this doesn't, you know, it's still a little bit swollen here and here. This is my right side. This is my left side. This is my nostril, and that is from that angle too. So you can see that, you know, it's not a bad nose even at this point, and yet it's still quite swollen. So, but I mean, to be quite honest with you, if it stayed like this, I'd be happy, because it's 100 times better than what mine was, and the fact that I have a straight profile is all I really wanted. You know, just to feel not so exposed. You do tend to a social piranha when you're not comfortable with who you are. So you know, I'm 100% behind anyone who wants to go ahead with this. Anyway, see you in another